Hi, I'm Howard Polansky,
Hey, I'm Steve Dukovic.
and we are Silver Key Benefits. In 2020, I don't think it's a surprise, COVID. So, in terms of going out and seeing people at their residences, we had to change. And thankfully, the insurance companies have gotten on board. They made things a lot more friendly from an electronic standpoint. And so we are trying to take that information and bring it to you through the electronic age, dispensing how Medicare works, the changes that are going on for 2021, how to reach out to us if you want us to look at your plan. Steve's got to leave. I was hoping he could stay so he can correct me, but you're just going to have to wing it with me, see if I got things right, and we'll pray for the best. So,
Well, and Howard's been doing this plenty long enough that he's going to do just fine. It has been a very interesting year. Um, this is a new thing for us in terms of trying to reach out to our client base and friends and relatives. So feel free to forward this to your friends and family, even your kids, because we're going to try and give you the nutshell version of things that you need to know for open enrollment this year and some of the changes that are taking place for next year. Because there are some significant changes that happen every year, and we want to make sure that not just you know them, but that you can share those pieces of information with friends that might benefit. One of the big changes that we're going to see for 2021 is a program that's going to significantly reduce the cost of insulin for people that are insulin dependent diabetics. So if you know people like that, please share this video, and there will be some notes down below about timestamps that talk about what we're talking about at specific areas. So you can say, hey, Mr. Friend, go look at the 20-minute mark on this thing, and that will talk about the stuff you need to know. Anyway, really look forward to talking to you in person or Zoom or however we end up talking for this open enrollment. And I hope you enjoy the video.
all right, get out of here. Let me do my thing. So let me share my screen. I will be completely honest. My PowerPoint presentations, it's just information. It's not pretty, but you're not paying for pretty either. So Medicare for 2021. All right, so who we are. Silver Key Benefits was founded by Steve Dukovic. I joined Steve in 2018. For people that know me, when I have been going to residences these last couple of years, I'm that pie guy. I'm the one who brings the pies basically to bribe you to listen to me, talk for about 30, 40 minutes. We are Medicare brokers, okay? So that means we are not just Humana or just Scott and White or just United Healthcare, because there is no one perfect plan. We have to find the best plan for you in your specific situation. And most importantly is that there is no fee to you. I just say there's a marketing budget for these insurance companies. We get compensated from that marketing budget, okay, from the insurance companies themselves. And the compensation is regulated. So whether you choose Aetna or you choose United Healthcare, I really don't care. Steve doesn't care. It's just what's right for you. All right, so the objectives with this video is the overview of Medicare. If you've seen me these last couple years, this presentation really does not change, so you can skip this if you'd like. Then we'll go over the changes for 2021, the ones that may matter to you. And then finally, how we can help you during this age of COVID. All right, so overview of Medicare. I'm going to start from the top, and that big word that I say Medicare, that is to symbolize the United States government. There are 4 parts to Medicare. There's a Part A, B, C, and D. Part A is hospitals, hospice, skilled nursing facilities. The premium for Part A is $0 a month. So when you go on Medicare, from your vantage point, Part A is free. Part B is the doctor visits, outpatient procedures, durable medical equipment. Think of your wheelchairs, your walkers, your sleep apnea equipment. That there is a premium for. The premium for that is $144.60 a month in calendar year 2020. We do not know at the time of this recording, which is the beginning of October, what the new Part B premium will be. It usually gets released in November. Part A and B cover 80% of your medical costs. So if you go to the doctor and the Medicare price for that doctor visit's $100, Medicare pays $80, your portion is 20% or $20. If you have a procedure that's $1,000, Medicare will pay $800, your portion is 20% or $200. If you are in the hospital for 10 days and it costs $100,000, Medicare pays $80,000, you're on the hook for $20,000. That 20% does not have a maximum. Okay, so how do we make sure we don't have in this example, a $20,000 oh no moment? Okay, and so we can go one of two ways. I'm going to start on the left-hand side, which I call public Medicare. That's staying on original Medicare. And the way to cover that 20% is to get a Medicare supplement. Now, to make things confusing, you have Part A, B, C, and D. Supplement plans go from letters as well, A all the way to N. I am only going to focus on Plan G because starting January 1, 2020, anyone that is aging into Medicare can only get a Plan G. So I'm going to keep it simple. You will have 3 cards in your wallet. One is going to be the original Medicare card, which we call the red, white, and blue card. That supplement card, the second card is the supplement itself, which will say Medicare Supplement Plan G with whatever insurance company. That's card number 2. Card number 3, which I'll get to in a little bit, is the drug plan. But if you have that supplement, it will pay that remaining 20%, whether that 20% was the $20 or $20,000. It pays the remainder. With that, staying on public Medicare, you can see any doctor that takes original Medicare, which is 99+ % of doctors that are out there. You can go to any hospital in the country. You can go anywhere in the country. You do not need a referral. So if you want to see your primary doctor on Tuesday, a gastroenterologist on Wednesday, a cardiologist on Thursday, you walk in, you walk out, you don't have a bill. What are the downsides? The downsides are you are paying for this up front. There's a couple factors into it. It's easiest to think that this is age related. So someone that is aging into Medicare, they're turning 65, the premium for that is going to be roughly 90, maybe $100 a month. My grandmother, may she rest in peace, she passed away last year. She was 1 week shy of 101. Her Medicare supplement was costing over $400 a month. Why? As you get older, greater chance you're going to be using more services. You also need a separate drug plan, which is Part D. Yay, the government got it right. Part D for drugs. In a drug plan, the premium for that is going to be anywhere between $50 and $80 a month. Never needed to put anyone on an $80 a month plan, but it's out there. Okay, so when you sum it all up, as we look on the bottom left-hand side, it's extremely flexible. By going to whatever hospital you want, by seeing whatever doctor that you want. There's a tiny deductible associated with Plan G. It's $198 for calendar year 2020. Basically, you owe the first 1 or 2 doctor visits. After that, you are covered by Medicare. We do not know the deductible yet. For 2021, it will be released when they release the Part B premium. And I put it as neutral, the sideways arrows, that the costs are up front. So really it is, this is your medical costs. Drugs are its own separate bucket, but in terms of medical costs, this is it. So if you are someone that is healthy, it kind of acts like car insurance. You pay, you pay, you pay. You don't want to get sick, but you know that if something happens, I know that I'm covered. For other people, it's a godsend. I had one client, she went on to Medicare in January. In April, she found out she had breast cancer. She just had to pay the premium plus that $200 deductible. Everything else was covered. So for her, this was an absolute bargain, okay? Now, some people are going to see this and say, you know, I am healthy, or it just doesn't fit in my budget to pay this up front. Is there another way to do things? And the answer is yes. So we're going to go now to the right side of the page where I wrote privatized or private. That is Part C. Part C is also known as a Medicare Advantage plan, okay? And why I call this privatized is that it's not the United States government that's running your Medicare anymore. It is a private insurance company that's managing your Medicare on behalf of the government, okay? And so the two most common structures are an HMO and a PPO in the Austin area. And so if you had a PPO in either case, with an Advantage plan, you're going to just show one card. It's the same card you show the doctor, you show the hospital, you show the pharmacy, okay? In most cases, the HMO is going to be more affordable than the PPO in terms of a premium and in terms of copays, okay? We'll have the drug plan bundled into the Advantage plan, okay? What are the downsides? The downsides with a PPO is that you do have a higher copay, okay? In terms of seeing doctors, if you have an HMO, it might be, for a specialist, it might be $30 a visit. For a PPO, it might be $45 a visit, okay? In most cases with an HMO, that you're going to need a referral from your primary care to see your specialist, okay? And the primary downside is that you have to be in network, okay? And what I mean by that is that if your doctor does not take this specific plan, you can't see them, all right? And so when you add it all up on the bottom here, as I said, it's cheaper up front. It's a pay as you go plan, okay? There are added perks. And here's what I mean. There are 4 things that Medicare, original Medicare, does not cover. They do not cover dental. They do not cover vision in terms of glasses and contact lenses. Glaucoma and cataracts, that's a medical procedure. That is covered. But in terms of vision, glasses and contact lenses are not. They do not cover hearing aids. They do not cover facelifts. So if you're looking to go get that plastic surgery and get the facelift and the, you know, whatever else lifted, not going to happen under Medicare, okay? With a Medicare Advantage plan, these plans are allowed to add those types of benefits. So they can add a dental benefit. They can have discounted hearing aids. They can give you a vision benefit in terms of $100 or $150 towards glasses or contacts. They can provide transportation to and from doctor's offices. They can have a benefit for acupuncture, all right? But there are restrictions, and the restrictions are you have to go to doctors in network. So let me give kind of 3 examples that kind of really differentiate the left side of the page versus the right side of the page. Now let's just pretend that you are visiting family up in New York. You know, you live here in the greater Austin area. You're up there and you, God forbid, you have a heart attack. What happens? Because a heart attack is a life-threatening condition, it does not matter what plan you have, left side, right side, you are covered, okay? Anywhere in the country, you're covered. Different time, you're going out to Los Angeles and you get a case of the shingles. What happens there? Well, if you are on the public side and you have a supplement, because you can see any doctor, any hospital, anywhere in the country, no referrals, your visit will be covered. If you have an Advantage plan, the insurance company could come back and say, Mrs. Jones, we know shingles stinks. However, shingles is not a life-threatening condition. You were out of your geographic zone, and because of that, you're paying the whole bill. Final scenario, you get a diagnosis of cancer. Your next immediate thought is, I want to go to the best cancer hospital in Texas. I'm willing to drive myself to MD Anderson. If you have a supplement, they will be happy to see you because they do take original Medicare at MD Anderson. If you have an Advantage plan, they will see you, but they do not accept Advantage plans. And so you're paying for all of it in cash. Okay. The three big questions that I get when it comes to going over this sheet is, well, how easy is it to go from the left side to the right side to the left side? Okay. So to answer this first question, any year you want, you can go from the left side to the right side. You can go from public Medicare to privatized Medicare, and you can have a 12-month trial period to see if you like an Advantage plan. To go from the right side to the left side, after that 12 months, you need to be healthy. You need to qualify to be accepted for this supplement. Okay, so it's easy to go left to right, harder to go right to left. Next question I get is, how easy is it to switch plans? Okay, well, as I said, with the supplement, to go from one plan, because a plan G is a plan G is a plan G, the only difference is the price you're paying. If you're paying above market rate and you're healthy, we apply, and if you get approved, then all of a sudden you have the exact same coverage and it's cheaper. If you have an Advantage plan, we can change Advantage plans every single year. Okay, there are no health questions that you have to worry about, and you will always have coverage. Final question, what if we choose a plan and my doctor is not on that plan next year? And this is where Medicare, I give them credit, they actually got really smart. In years past, especially before the internet, what would happen is people would see that Dr. Jones was taking United Healthcare, and then they said, oh, well, I'll go on United Healthcare. And then the January 15th, they go to see Dr. Jones, and the nurse in the front just says, that's wonderful, you have United Healthcare, but Dr. Jones stopped that the end of last year. And then you were not able to see Dr. Jones for the entire year. And Medicare finally got smart to it and said, you know what? We're not here to try and stop people from seeing the doctors that they know, like, and trust. So let's just say that we were on Aetna and we switched to United Healthcare, and this situation happened to you. You would say, okay, I'm not going to see Dr. Jones right now, but please give me a list of Advantage plans that Dr. Jones is accepting for 2021. You would come back to me with that list and say, Howard, here's the list of plans that I want to go on because the one that you put me on did not work. And so having that, we have until March 31st to get it right. We got one more shot to get it right for you to see your doctors, okay? So those are the three big questions that I normally get asked. The main questions that I ask in terms of left side versus right side, to know which kind of way, just to help guide people. I'm not forcing anyone into anything. And same with Steve. We're not forcing anyone. But the main questions I ask people is, do you want flexibility of doctors? You know, some people, the whole network thing, it just doesn't bother them. All right. So you don't care if it's in network, out of network. Other people, having that flexibility means everything to them. And if that's the case, then we're going to make sure that we do a supplement. Next question, do you want to minimize costs up front? Whether you're just healthy and you just don't go to the doctor, or it just does not fit into your budget right now, whatever the reason is, I have to take that into consideration. And then the final part is, are you go, slow-go, or no-go? And people kind of laugh at this, but what I mean by go-go is, if I know that you have an RV and you plan on traveling everywhere, you're a go-go person. And you need to know that your insurance is going to cover you wherever you go. And if that's the case, we are definitely leaning towards a supplement, okay? if you were like my grandmother, my late grandmother, if it was not within 10 miles of where she lived, the rest of the earth could have just fallen off to wherever into oblivion. She's a no-go. She's not going to travel anywhere. Okay. So she could have switched to an Advantage plan really without an issue. Slow go is those people that maybe they go take a trip down to Corpus, maybe they take an occasional trip out to LA or Denver, but they're really kind of homebodies. Then again, we're going to look at the other factors to kind of figure out what makes the most sense. Now, I have a lot of people, especially in the Pflugerville area here in Austin, that have asked about Scott and White, because a couple of years back, Scott and White, there is Scott and White, the doctors and hospitals, and then there's a separate division of Scott and White, the Medicare Advantage Insurance Company. Okay, and obviously they talk to each other, but they are two very distinct separate things. So I'm talking about the insurance part. They have a separate Medicare Advantage plan. They used to be in Travis County. Okay, for bigger reasons that I need to get on this video, they're not in Travis County right now. Okay, they are in Williamson County, but not in Travis. And the people that are in Pflugerville have asked, there's a big freaking hospital that was built by Scott and White just down the street. How are they not in Travis County? The reason is, as of 2021, that if you live in Travis County, you cannot get a Scott and White health plan, is because it's more than just Pflugerville. They have to have coverage for the entire county in terms of not only generalists, but specialists. And even though it's a stone's throw away, that's just basically for Pflugerville. They don't have enough coverage for as vast as Travis County is. Hopefully in the future, that Scott and White plan option does become available. Not here yet. Income limits. Again, the clients that I have range drastically in terms of their income limits, okay? So I had to make this as general as possible for people to really kind of understand how this all works. But let me just kind of say, there's special rules in place for people that don't have a lot of income, and then there's other rules in place for people that have quite a bit of income. So let's kind of go through that. I'm going to start on the low side. If your monthly income is, as it is shown either by pay stubs or it's just Social Security or basically like your tax return, if you file as single and your income is under $1084 a month, or if you're married and it's under $1457 a month, there are special plans that open up that combine Medicare and Medicaid. And they are very, very powerful plans, and something that you definitely want to inquire with us about, okay? The next level up is from $1085 a month up to $1296 as single, and then up to $1744 a month if you're married. Think of this as the next level to make it super simple or oversimplify it, the federal government will pay your Part B premium. So that $144.60 will actually get added back into your Social Security check, okay? The next level up, if your monthly income is under $1456 a month as single or under $1967 a month as married, it's the state that can pay that Part B premium, but you have to apply every year because the state only has so much funds. Again, I might not be saying this technically correct, but it's just the easiest way for people to understand. So the first statement is the federal government. The second one is the federal government, and they'll help pay your Part B premium. The third one is the state paying your Part B premium, but you have to apply each and every year. On the flip side, if your income limit is high, you have a special Medicare tax called IRMA, okay? Hopefully that's not your wife's name because you're gonna get angry at her. What this is, they look at your tax returns from 2 years ago. So for 2020, they're looking at your 2018 tax returns. For 2021, they will be looking at your 2019 tax returns, and it's your adjusted gross income. So for singles that made more than $87,000, and it's literally by $1 over, you're going to have this special tax above and beyond. And this is both on Part B, the doctor visits, and Part D, the drugs. There's a separate charge just for that, okay? And so you can see the various tiers here. This is not going to change much because it will now be indexed to inflation. And I'll be honest, this bit me in the butt just a few weeks ago because I have a new client and he told me what his income is. And I was like, okay, we're in tier number 1, not a big deal. Well, he called me up maybe 2-3 weeks ago to say, you know, I got this extra invoice from Medicare for X amount of dollars. And I'm not going to say because you would be able to figure out the tier. And I'm just like, I know what your income is. Is there something that happened in 2018? And he said, as a matter of fact, there was. There's a company that I had a good amount of stock in and it got bought out. And so all of a sudden I got this big payday. And I was like, oh, okay. So here's what's going to happen. For the rest of 2020, you're going to have this IRMA tax. There's nothing you can do about it. But then when it gets to 2021 and they see what your quote unquote normal income is, that will go away. And so it's something that I've got to be better about in terms of asking, what was your income 2 years ago to make sure that this doesn't come back and bite you in the butt, which really bites me in the butt because I didn't warn you about it. Changes to Medicare for 2021, really what you guys were waiting for. Drug plans. I am definitely not going to get into all the intricacies of drug plans because it's crazy, but let's just kind of go through the highlights. There is a deductible every year for the drug plan, separate from the medical. The deductible in 2020 was $435. The deductible for 2021 is going up a whopping $10. Not too bad. Drug plans act very bizarre because if you're healthy, you have to pay up to that deductible. If you're a little bit sick, then you have coverage. If you're moderately sick, your coverage goes away for a period of time. And if you're really sick, it comes back, okay? In that moderately sick area, that's what's known as the donut hole. And so the donut hole, they've increased it on the part that matters to you. They've also expanded the donut hole on this side. So they've kind of moved everything up and you can see the things there. In terms of medications that it's affecting, it's the tier 3, 4, 5. I'm not going to get into that, but let's just get to the real meat of this here. And this is what Steve was talking about. Those that take injectable insulin, okay? These are usually very expensive drugs in the neighborhood because you have a fast-acting one and a slow-acting one that you have to get those injections, I think usually every day or every week. It has cost people $300 to $400 per month just for those 2 injections alone. A lot of the drug plans are now creating specialized formularies that will include these injectable insulins and cap it, I believe at $70 a month, but I just want to say under $100 a month, dependent upon the plan that we choose. And so this is why it's really important that I know all of your drugs and know what pharmacy you like to go to. If there's one that you love, I need to know that. If you're flexible, I need to know that, because depending upon your drugs and depending upon the pharmacy, that's going to determine the puzzle piece known as the drug plan that's going to make the most sense, that fits all those pieces together, okay? The other nice perk is Cialis and Viagra. These 2 drugs are not on the Medicare approved drug list, okay? So they've never been covered by Medicare, but they have been around so long that they are now generic. And to be a value add and to try and entice you for a certain drug plan, Some of these drug plans have now included it on their formularies and said, yeah, Medicare may not have it as an approved drug, but we are going to include it on our list to say, come over to our drug plan. So there's a quote unquote perk. Here's another really big change. And this is something that if you know someone that is on dialysis, that they please get in touch with us, because this is really, really tricky and it's new. In the past, unless you were on a Medicare Advantage plan, if you were diagnosed with end-stage renal disease, you could not get kicked off the plan. If you had kidney disease, and specifically ESRD, before you had the option to choose an Advantage plan, you could not choose an Advantage plan. Now, 2021, Medicare said all companies have to give those with ESRD the ability to go on a Medicare Advantage plan if they choose. Now, the reason why I say this is tricky, and I'm putting a big warning sign here, we've got to understand the financial situation. And in terms of what I've read, those that are on dialysis, it costs them out of pocket approximately $35,000 a year just for the dialysis. Now, again, this is what I've read. I don't know, and Steve does not know, if this is actually the case, because I've heard from people that the kidney foundations will basically come in and make sure that people do not go bankrupt from dialysis. And so we are treating this type of situation with kid gloves, where they're at may be the best plan for them. But, if you know anyone that is going through dialysis on obviously a regular basis, because they have to go minimum 3 days a week, please get them in touch with us, because it will be really helpful for us. Even if we don't do a thing, it just lets us know how to play with this situation moving forward. Last thing I want to talk about is something known as a Medicare savings account. For those that are aging into Medicare or soon to be on Medicare, you might be like, MSA, that sounds like a HSA, a healthcare savings account. And the answer is yes. It is the exact same concept, except for you cannot put money with an HSA. You put your own money into this special plan because you have a high deductible plan. In this case, you don't put money in. This Medicare savings account, this insurance company is going to put money in on your behalf, okay? And there's two different tiers. I want to work, just to keep things simple, I'm only going to talk about the lower tier, because I'm looking at it from a risk perspective in terms of what's the worst case scenario in terms of cost for you, all right? But here's the way that it works on a high level. It is technically an Advantage plan. And as I said, an Advantage plan has restrictions in terms of the doctors, but this one is a twist. There's two twists. Number one, you're paid money up front. January 1, you get $2,000 on a card for you to use for healthcare expenses. Number two, whatever money you don't use of that $2,000 will roll over into 2022, and they will add another $2,000 on top of what remains. The money is yours. You keep the money. Okay? Number three, which I didn't even put on here, is I talked about restrictions. With this MSA plan, there is no restrictions. As long as a doctor takes original Medicare, they will take this type of plan. They may not have seen it because this is an up and coming plan. It's been now in Texas for 3 years, but it's something that they take by law, even if they don't recognize it. And we've had to speak to doctors and trust the process. And yes, it works. Okay. Now let's get to the last bullet point. If you have a health event, okay, the deductible with this plan is $5,000 for the calendar year. okay? But remember, you got $2,000 to begin with. So your true net out-of-pocket cost would be $3,000 if you chose this plan, okay? Remember, if you go back to what we said about a Medicare supplement is you're paying that premium up front, you have that $200 deductible, you're covered whether you use it or not. In this case, you're getting $2,000 up front. If you go through the $2,000 of medical costs, then you have to start paying out of pocket up until $5,000 total. And so it would just be $3,000 out of pocket. But if you did not go through all that $2,000, let's say you have $1,200 left, that rolls over to 2022. You then have another $2,000 added for 2022, and you'll have $3,200 to use in calendar year 2022. Who might this be good for? The first is you're healthy. You might go to the doctor maybe once a year. I've met people that have not been to a doctor in 15 years. And so if this plan happened to be around for that long, they would have a healthcare bank of $30,000, and that $3,000 out of pocket would not be a problem whatsoever. The second people this might be good for is that going back to that Medicare supplement, okay? And if you're paying more than $250 a month for that supplement, there's one couple that I was talking to that I've got to send this video out to, and I said, this might be interesting to you. The reason why is that the husband has a supplement that he's paying $260 a month for. 260 times 12 is $3,120 a year. This plan will cap them at $3,000 a year if he gets to that point. Thankfully, in 2020, he's had maybe 7 or 8 doctor visits. Total, that might cost $1,000. And so in this situation, that first $2,000, like I said before, that would have paid for all the doctor visits, and there would have been money left over, and they would have saved $3,000 in terms of paying the premium for the supplement. So it's a very interesting idea. There's a little bit more paperwork. There's a little bit more administrative stuff you've got to do, but this can be very, very good for them. The final one is federal employees. And this is a really interesting one. If you know someone that retired as a federal employee, they have a special plan called FERS, okay? And the FERS plan does cost them $250 a month. Now, it does include a drug plan. It's a very nice plan, okay? But similar to bullet point number 2, it's kind of like a supplement. And so they have the potential to save $3,000 a year. Again, the potential, not the guarantee, the potential. But the really nice thing about the federal employees, there is a sheet that says, I would like to go onto Medicare like everyone else, but they have the flexibility to get back to FERS, which is very, very different from the teacher retirement system of Texas. TRS were very hesitant to move people off, especially the one who was the teacher, because once you're out, you have to sign a notarized affidavit saying, I want nothing to do with you anymore. Once you're out, you are out. And so you can't get back in. With the federal employees, they have the option every year to get back in. So this becomes very, very interesting. How do we do a review in the world of COVID? Okay. And so this is where technology is going to be, unfortunately, a necessity. I enjoy being able to sit down with you knee to knee, see how life is going. And it's just with my family having people that are at risk, I just can't do that And I think everyone understands that 2020 has just been a year of confusion. All right. But here's kind of how we're doing it. If you're happy with what you have, okay, you like the plan that you've got, your doctors are on it, you happy with the drug plan, we don't need to change a thing. Okay. And if you want, just forward this on to your friends, let them see, what's going on. Great. Be happy. Okay. If you would like to see, is there anything that we need to change for next year? I am going to have not only a link in the email that gets you to this video, I will have that same link below in the description, and it is going to send you to a questionnaire. Questionnaire is around 10 to 12 questions. It's asking for everything in terms of where you live, what city, what county, what pharmacy do you like if you care about a pharmacy, what doctors do you see, what medications are you on, because I need to have all of that information to see the plan that you are on right now. Is that the best plan for you going into 2021? All right. Now, please know that link that I am including in the description below will only go to me. So if you are one of Steve's clients and you fill out that questionnaire, I may not know you're Steve's client. Okay. And if I call you and all of a sudden we switch things, I mean, you're still part of the Silver Key family, but I know Steve would like to be able to help Steve's clients that he's gotten over the years. And I would like for Steve to help Steve's clients that he's gotten over the years. I will start reviewing those questionnaires in November. The reason why is I remember last year, one of the sites that I went to, someone gave me the list of medications that they go to. They told me they're flexible with pharmacies. I checked and there was a certain price in terms of what it would cost for the year. I went back 2 days later. The prices were different. The pharmacy was different. And so there was a lot of data tinkering that was happening. And I noticed once we hit November, that data tinkering kind of stopped. Okay. So I don't want to do all of this work and then all of a sudden realize later, like, oh, wait, you should have been on plan B when I put you on plan A. And I was just going by the data that I had. So if you fill this out October 10th and you don't hear from me from November 10th, no worries. Okay. I will get it done. I promise you. And then the final changes have to be in by December 7th. I will make sure we get it done well before that. And, reach out to everyone that I need to. So I want to thank you in terms of going through this. If you watched it from the beginning to the end, I just wanted to have both of our informations here so you knew how to get in touch with us. It's been an honor for both Steve and I to help people these years because of this stuff's confusing. And Medicare, not trying to throw them under the bus, but they don't make it easier. And that we can help, we can help people and help people save quite a bit of money and figure out what is the best plan for you. It's a real honor. It's a real treat to be able to review this every year. We would love to be able to help your friends and family. And if you found this of value, please forward this on so that they can get this information as well. I appreciate you. We thank you, and we hope to hear from you soon.